Understanding colorectal cancer. Symptoms, types, and rising risks. Colorectal cancer, which includes both colon and rectal cancers, is often a silent disease. In many cases, patients do not experience any noticeable symptoms until the cancer has reached an advanced stage, because early symptoms can often be mistaken for common digestive issues. Understanding the specific warning signs and shifting demographic trends is vital for early detection. Recognizing the warning signs, symptoms of colorectal cancer primarily affect the digestive system. While some signs are highly visible, others are subtle and may develop over many years. Common physical symptoms: changes in bowel habits. This includes persistent diarrhea, constipation, or a noticeable narrowing of the stool that lasts for more than a few days. Sensation of incomplete evacuation, a feeling that you need to have a bowel movement even after you have just had one. Rectal bleeding, the presence of bright red blood in the rectum. Changes in stool appearance, stool that appears dark or tarry, often indicating blood that has been digested. Abdominal discomfort, persistent cramping or pain in the belly area. Systemic symptoms, unexplained weight loss, general weakness, and chronic fatigue. The connection between bleeding and anemia, one of the most critical yet overlooked indicators, is slow internal bleeding. A tumor may bleed into the digestive tract so gradually that the blood is not visible to the naked eye. Over time, this continuous loss of blood can lead to anemia, a low red blood cell count. In many instances, a routine blood test revealing anemia is actually the first clue that leads to a colorectal cancer diagnosis. Understanding the different types. Colorectal cancer is not a single disease. It is categorized by where the cancer begins and which cells are affected. Adenocarcinomas, the most prevalent type, originating in the cells that line the inner surface of the colon. Carcinoid tumors, these begin in the hormone-producing cells of the intestines. Gastrointestinal, GI, stomal tumors. These arise from the nerve cells in the wall of the GI tract. These can be benign or malignant. Lymphomas, while usually associated with the lymph nodes, these can also originate in the colon or rectum. Note on location: the side of the colon affected can change how symptoms present. Left-sided cancer typically causes more obvious digestive changes and visible bleeding. Right-sided cancer is often more subtle, frequently presenting as fatigue and anemia due to slow, hidden bleeding. Risks and complications of delayed diagnosis. If left untreated, colorectal cancer can lead to severe medical emergencies. Bowel obstruction. A tumor may block the colon, causing nausea, bloating, and intense pain. Bowel perforation. A tear in the colon wall that can cause life-threatening infections in the abdominal cavity. Metastasis. The cancer spreading to vital organs such as the liver, lungs, or lymph nodes. The misdiagnosis, a significant hurdle in treatment, is that symptoms often mimic less serious conditions like hemorrhoids or irritable bowel syndrome, IBS. This can lead to delays in seeking specialized medical attention. A shifting demographic. Why age matters more than ever. Historically, colorectal cancer was viewed as a disease of the elderly. However, medical data shows a concerning trend. Rates of colorectal cancer in adults under age 50 are rising sharply. It is estimated that by 2030, roughly 15% of all cases will be diagnosed in younger adults. Because younger patients often assume they are not at risk, they may ignore early warning signs. In response to this trend, the American Cancer Society has lowered the recommended age for regular screening from 50 to 45 years old for those at average risk. Summary and next steps. Early detection is the most effective way to manage colorectal cancer, and can even prevent it entirely by removing precancerous polyps during screening. Monitor persistent changes in bowel habits or unexplained weight loss. Do not dismiss bleeding as mere hemorrhoids. Consult a professional. Follow updated screening guidelines, starting at age 45 or earlier if you have a family history of the disease. Conclusion: while colorectal cancer can be difficult to detect in its early stages, staying vigilant about digestive changes and adhering to modern screening age recommendations are the most effective tools for improving survival rates.